I was working as a pediatric nurse, and I was moving a child, and I herniated 3 of my discs in my low back. And after that had happened, I went through extensive conservative therapy and treatment to try to deal with the issue with other alternatives rather than surgery. It ended up where surgery was my only option. It ended up being very radical and extensive. They went through anterior and posterior through my stomach and my back and fused my lower 3 discs with titanium rods and screws and nuts and bolts. And I explain it to people that I'm held together by bubble gum and rubber bands. A lot of days I feel like there's nothing really holding me together. After my initial surgery, when I was in the hospital, I developed a staph infection in my low back that made me really sick, but they treated me and sent me home. And about 6 months later, I started getting really sick. Started hallucinating, started having very high fever, and it just seemed normal at that time. I was so sick that I kind of wrote it off. When I went back into the doctor after a couple of weeks of this happening, they checked my blood work and went in to kind of explore my area in my back where the infection was. They ended up realizing that my entire low back was infected with this staph. It had migrated into my bones, into the muscle, the soft tissue in my back, into my hip where they had removed bone. So they sent me home with a PICC line going in my arm, up through my brachial artery into my heart so that I could get IV antibiotics 3 times a day for quite an extensive, long period. This surgery left me completely debilitated for a long time. It changed my life so dramatically in a way that I would have never foreseen. I was 23 years old when I injured myself initially. I was at the prime of my life. I had worked so hard to become a nurse. I had given my life to community service. I had dreams and passions in my future. I was in love. I was getting married. I went from 100 miles an hour to 0 in one day. Over a period of time dealing with these surgeries, one after another, the pain had never subsided. I just have never had any relief in the 10, going on 11 years since I hurt myself. The pain is off the chart. Some days, it's a 10 on the pain scale. I can't even cope. The pain gets so intense every day that I get, I'm continuously nauseous. I spend my day, basically everything is churning, and I'm always kind of having a difficult time holding down my food, keeping everything in place. I'm on quite a few opioid pain medications to help with my pain. Those add to the nausea. The pain creates nausea. The pain meds create nausea. I wake up every morning and, I require food in my stomach to hold down my OxyContin, my hydromorphone, my Somas, my gabapentin. I need food, and I can't stop the nausea in the morning. So for a long time, I was taking the medications and I was throwing up, and that would happen all day long. Years went by and I was complaining to my doctor, and they tried me on every medication, Zofran and promethazine, and I've tried everything conservative. I used ginger, I used peppermint, I used deep breathing, everything I could. I used circulating air when I'm nauseous, and nothing works. So, I had, experimented with cannabis. It clearly it helped in a number of different ways, but primarily with the nausea and the pain. I even noticed that the amount of pain medications that I required was diminished because of the cannabis. On top of my back injury, I was also diagnosed with ulcerative colitis when I was 10 years old. I lived for years with literally holes in my colon. When I was 20 years old, my doctor said, listen, you've lived with this so long that with that constant irritation, you will develop cancer at a very young age. So we need to remove your entire colon and rectum. So, 20 years old, I thought of my different options. Do I want to live with a colostomy bag for the rest of my life? Is that a risk I would like to take? Well, I made that choice to take that risk. And luckily, now I don't have a colostomy. They reconnected my small intestine to my anus and basically have created a pouch inside my intestines to simulate my colon. Long story short, this has left me with a lot of residual issues. Every day I live with chronic diarrhea. When I was sick, I was going probably 50 times a day. Now I'm going maybe 10, 15 times a day, but it's always diarrhea. I bleed, I have a lot of cramping. It's embarrassing. There's emotional toll involved. There's just a lot of factors. So, I have all these medical issues kind of one on top of another. I had been seen by a pain clinic since I hurt my back. And, for years I had, great care. And they had talked to me about transitioning my care from my pain management clinic to my primary care doctor. A lot of my medications had just been stabilized. My pain was consistent. My issues were chronic and not changing. There's nothing acute. They felt, switch me over to my primary. So I went to my pain clinic, and at the time I was on hydromorphone. I had run out of my prescription. It had been a few days where I didn't have a prescription. So I went to the doctor and said, listen, this nausea is just persistent. I'm still, after all these years, I'm screwed up. Please help me. And I also asked that day, I said, I need something, a medication where I'm not waking up in the middle of the night to take pain meds. I need something that lasts for 12 hours so that I don't have to take pills all day for pain. Well, this prompted him to do a test. And I wasn't even thinking about cannabis for some reason. I don't know why I wasn't. But the next visit a month later, I went back, and he said, you tested positive for THC. And so I admitted to using it. I told him what I used it for. I experimented with it a few times, and it greatly helped. I also explained to him that I have 17 years experience in the medical community. I've been working as an HIV/AIDS counselor for 17 years now. I've been a registered nurse for 11 years, working in various areas. So I tried to explain this to him to, make him understand that I just wasn't some common guy on the street. Maybe break that stereotype that I'm a drug seeker or whatever. So he counseled me for quite a while on the do's and don'ts of what he thought cannabis was. It turned out he really didn't know much at all. I said, I have a familiarity with this medication called Marinol. I actually ended up doing a little bit of education about it in the doctor's office to a pain doctor. And he turned around to me after about a half an hour and said, I'm not going to prescribe you Marinol because that's the legal form of marijuana. So more or less, I said, thank you very much for the care you've offered. I'd like my medical records, and I went to the primary care provider that they had suggested in the first place. So I went to my primary, went through the same struggle with him, but he was receptive. But he wanted to make sure I wasn't a drug-seeking person just trying to smoke pot on the street. So after a lot of counseling, he agreed with me that Marinol would probably be a really good, effective option. However, it's very expensive.
More so than pot.
Very, very expensive. Almost $1,000 a month is what my Marinol costs. I had settled several years ago with workman's comp. I was under the workman's comp system. I received weekly paychecks. I settled with them, thinking that I would be able to take my life back, do something good with this adversity that was thrown at me. I was given a shit deal, and I don't like to complain, but if I told you every detail, it was pretty tragic and crappy what had happened. So I settled with workman's comp, thinking I'd have some of my life back. And when they got wind that I had smoked a little pot to help with this nausea, they denied all of my medications, and it was the day before Thanksgiving. They left me for the entire week of Thanksgiving going through opioid withdrawals. I went into my doctor shaking, convulsing, sweating, crying.